CPT JJ-CPV Evaluation and Management, E&M Services and Guidelines. This is Chapter 7, Part 3. Okay, levels of E&M services, and it reads like this.
This circumstance,
which means E&M service promoted, right?
Right, promoted. Evaluation management service promoted by previous condition.
This one may be
reported by adding modifier 25 to the appropriate level of E&M service.
Right. So what they're telling you here is if in an E&M service, in E&M visit, the doctor advises a subsequent procedure, then you have to put a 25 modifier there because there's going to be like a follow-up, and then you code the procedure. This is the procedure the doctor advised. This is the example, okay? So that's our theory. Now let's do a problem. And ready, set, go. All right. CPT JJ-RVA, page 284, exercise 203, and this is a level 1 exercise. And the keyword is fulguration, right?
Right.
Now, can you read the problem?
Review. Patient presents to the operating room for fulguration of bladder tumors.
Okay.
The cystoscope was inserted and entered the urethra, which was normal. Bladder tumors measuring approximately 1.5 centimeters were removed.
Okay. So this is fulguration using a cystoscopy, right? And fulguration means destruction of tissue, right, with electricity. And what they're doing is they're getting to the tumors, right?
Right.
And they give us the dimension of the tumors. Okay, so that's the procedure. Now we're going to count to 3 so you can pause the video and give us a CPT code for this procedure. 1, 2, 3. All right, the answer is 52-234. Okay, did you get that? If you got it, congratulations. If you didn't get it, let's give you a couple of tips. Okay, the first is start with cystourethropy. Okay, this is a cystoscope that is inserted through the urethra, right? Which you know that is the tube that goes from the bladder to the outside. Okay, and for your information, the second tip is that fulguration means destroying tissue, or in this case tumor, with electricity, right? That's what fulguration means. And if you want to understand a little more about the video, we have some links, starting with a video that we made ourselves because we couldn't find one specific for fulguration, so we made this video, right? But the other ones, they talk a little more about cystoscopy, right? How it's done, right? And the ones that have A+ are the ones that you should watch. And if you are still interested, you can watch the other ones too. All these, okay? So you have the tips, you have the links, and you have the answers, so you have everything. Now we're going to count to 3 so you can pause the video and give us the path, how we got to the answer, okay? So 1, 2, 3. Okay, this is the summary of the whole problem. This is CPT JJ-RVA-284-203 level 1. Level 1 means that it is a regular problem. It's not too easy, but it's not too hard either. And keyword is fulguration, right? And the review says the patient presents to the operating room for fulguration of bladder tumors. Okay, so he has tumors in his bladder, which is the sac that contains the urine, right? The cystoscope was inserted and entered the urethra. Okay, the urethra is a tube from the outside to the bladder, which was normal. Bladder tumors measuring approximately 1.5 centimeters were removed. That's the procedure. There's only one code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
You start with cystourethropy.
Cystourethropy, right? Because that's a cystoscope that is inserted through the urethra, which is our case, right? And then
with fulguration.
Which means that they're not just looking, but the scope is just looking. But they're also going to do something, right? They're going to destroy tissue with fulguration. So you have to look for the with fulguration. And what are they destroying?
They are destroying the tumor.
The tumor, right? So you have to look for the word tumor. Now, when you follow this sequence, you're going to find 3 codes. 1, 2, 3, 52, 234, 235, and 240. Now, how do you know which is the one? You have to go to the tabular for that. So the code 1 through the tabular is found like this.
First, you got a tabular.
Go to the tabular.
You start with the code 52234.
You start with the first one of your list, right? And read what it says there. What does it say there?
Cystourethropy with fulguration.
Which is what we want, but what type of tumor is this?
It keeps going on until it goes to small bladder
Small
tumor.
bladder tumor, and it gives you the dimensions, right? So it's 0.5 centimeters up to 2.5 centimeters, right?
2.0 centimeters.
2.0 centimeters, I'm sorry. 2.0 centimeters. So this is the range to be considered small, right?
Right.
And remember that ours is 1.5, which is here, right? Just to be sure, you give a quick look to the other ones. Well, what is the 235?
And that is a medium.
Means the tumors are a little bigger than 2.0 centimeters. And the next one is for?
Large.
Large, which are even bigger, right? So you have to go back to the first one, which is for small tumors, because our tumor is 1.5 centimeters, right? So that's why we have an equal sign there. It means that this one is the code. This one is the answer. So the answer is 52234. Okay, so thanks for watching, and don't forget to visit our website, and also you can subscribe to our videos by clicking here, and then you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that is needed to pass the medical coding certification exams.
So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.